short word about sterility. Every single operative procedure requires completely, perfectly sterile instruments. We achieve that by the use of this autoclave. It treats the instruments at high temperature and high pressure to achieve that perfect sterilization. My assistant, Joy, will explain in a little bit more detail. Sterility of the instruments is achieved and monitored by several mechanisms. Joy, would you explain to us how that works?
One thing we use is a biological spore tester that is used daily to monitor the sterilizer itself, an integrator that verifies that the steam and the temperature is achieved, and also an indicator inside each pack that shows that the steam penetrated and the sterilizer reached its temperature.
So, Joy, do you think that this mechanism is adequate for achieving sterilization for our tools?
I think it's more than adequate.
Thank you so much. Hello, Dr. Tom Trevisani, continuing with our preoperative evaluation and consultation facts as pertinent and pertaining to different operative procedures. Today we're going to talk about abdominoplasty or tummy tuck. Abdominoplasty or tummy tuck is an excellent, outstanding operation which is intended to remove that large lower roll from the belly button down to the inguinal crease. Some of us need a little additional help when contouring the abdominal wall. The abdominoplasty is perfect for it. So we're going to cut away and then we'll be back with our model. Thank you. Here we have an actual patient who's preoperatively preparing for her tummy tuck or abdominoplasty. Now, the single most important decision-making process for this procedure is the incision site or the scar, as previously mentioned. Now, in this patient, I'll show you exactly where the incision will be in order to remove this small roll, although may not be too unsightly to any of us. To her, she wants it gone. So the decision-making process for the abdominoplasty, as with all other operative procedures, is related to the patient's desire. So we make our incision from hip bone down along the bottom of the panniculus to the other hip bone. That will allow us access to excising the roll. The next incision will be a counter incision well above the area along the upper abdomen, allowing this entire segment of skin and fat to be removed. Then, the point of excision from the midline, along with the remaining tissue, is separated from its underlying attachments and advanced down to the lower inguinal region, forming the newly draped abdominal wall without the roll. Single most important factor is the incision. Now, there are other potential risks with this operation, bleeding and infection, as with all operative procedures. But the single most important fact to remember is the scar. Abdominoplasty. Thank you. Continuing on the body contouring path, we'll now talk about liposuction. Liposuction first began in the early 80s as an attempt to remove fat in unwanted areas. It has evolved into a three-step procedure with much more sophistication and greater degree of happy results. Most common area for liposuction, lateral thighs. Also, inner thighs, knees. We can also do the abdomen and other parts of the body. The thing we need to know about liposuction is that, one, small scars, small incisions in each location, 1/4 of an inch, 1/8 of an inch max, are required to access. Then, a special type of fluid is pumped into the area, which begins the dissolution process of the fat. Once that is completed, then my technique uses an external laser beam for 10 to 15 minutes to further enhance the dissolution process of the fat and fluid. And lastly, we use our special cannula or tubes to aspirate or suck out the fat, giving us the contour we desire. Therefore, liposuction, the goal and the benefit is removal of fat from unwanted areas. Risks are small scars, asymmetry, bruising and swelling, which go away in time, And most importantly, to remember is the fat is lumpy. It exists in lumps preoperatively. Our goal is to make those lumps smaller so that they come out as evenly as possible. There you have liposuction. We're moving on to the next procedure. Thank you. Hello, Dr. Tom here, continuing in our attempt to communicate with you pertinent information prior to you and I meeting for your consultation. Keep in mind, cosmetic surgery can help you be your best. We'll help you to make your right choices. Also keep in mind, every operative procedure has benefits and risks. We'll discuss those in detail during our live consultation. I hope that this video has helped serve as an introduction to your consultation process, and hopefully you'll develop some good questions, and we'll move forward now with your consultation. Thank you so much. See you soon.